Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
One of the things we have to look at all the time as clinicians, in my opinion, is vitamin D levels or optimal vitamin D levels. The Institute of Medicine suggests that a level of 20 to 50 nanograms per milliliter is generally adequate for bone and overall health in most people. Even the Endocrine Society recommends a slightly higher range. They suggest 30 to 100 nanograms to be more beneficial. And of course, we've talked about before, somewhere between 60 and 100 is more optimal, in my opinion. Well, the potential benefits of high levels of vitamin D are crucial for calcium absorption, bone health, of course, and to prevent osteoporosis and fractures, particularly in the elderly. Vitamin D plays a role in modulating the immune system as well, and some studies suggest higher levels might reduce the risk of infections and autoimmune disease. Research has explored links between higher vitamin D levels and a reduced risk of chronic diseases such as cardiovascular, certain cancers, and even diabetes. Now, many articles like Garland has been written to show that in the American Journal of Public Health that there's epidemiologic evidence that higher vitamin D levels are linked to reduced cancers, particularly colorectal as an inverse relationship. Holick in 2007 said vitamin D in the New England of Medicine helps the immune function and chronic disease prevention, and higher levels could reduce osteoporosis, cancers, and autoimmune disease. Piltz in 2011, who did a systematic review and meta-analysis in the European Heart Journal, also found that there was a relationship between D and cardiovascular health, higher levels, which we're talking about. And just to round this off, Zitterman 2012 found that vitamin D and mortality. It showed that higher vitamin D levels lower the mortality, actually benefit to overall longevity. What's the takeaway? As clinicians, we should be testing 25-hydroxy vitamin D regularly and adjusting the patient's supplementation accordingly. Why 25-hydroxy vitamin D? Because it's the main circulating form of vitamin D in the bloodstream. It's produced in the liver from either vitamin D or D3, and it's the best overall indicator of vitamin D status. 25-hydroxy D has a relative long length of 2 to 3 weeks. It makes it easy for us as clinicians to reflect on it. And this form also shows that vitamin D obtained from both dietary and sunlight exposure. So it's a comprehensive picture of an individual vitamin D status. Now, most clinical guidelines and research studies, 25-hydroxy vitamin D is the one that's used. So we should be using that literally also in our determination of patients' health, because it does reflect the standard of diagnosis and monitoring. Thanks so much for watching.